Hello again, Mark Norton here in Truro, now just under 4 weeks since my own H1 ceramic hip resurfacing. In this episode we're looking at medical fitness, getting your general health as good as possible well before surgery so that everything goes as smoothly as possible and recovery is quicker. You'll often be aware of your hip starting to play up for quite some time before you get seen by a specialist and booked for the operation. You normally know that things are getting to the point that something's going to need to be done about it, because it's not one of those things which is getting better on its own. So make the most of that time, use it wisely, get yourself as fit as you can, or at least fighting to keep your fitness levels up. Having a major operation like a hip resurfacing or a replacement causes a major stress to your body's physiology. You really need to be fit enough to endure the challenge. It's like preparing yourself for a marathon, and you should take it seriously, and you should take control of your risks rather than leaving it to the medical team to deal with everything. From my own experience of seeing thousands of patients over the years, patients who manage to stay fit and active and address their health early on tend to have a much easier time post-op. They tend to have fewer problems, get back on their feet faster, and that's the key to reducing your risks of some of the major risks such as blood clots and embolism. I made sure I stayed as active as possible even when it started to get really painful. So I kept an eye on my weight and diet and sorted out everything that needed attention. In my case, my blood pressure had started to creep up, so I kept a close eye on that with a home monitor and then took those readings to my GP to get it under control. So here are the main things to focus on and the evidence behind them and some practical steps. So it's really important to do these well in advance, because if significant issues are picked up at your pre-op assessment, the hospital may postpone or cancel your operation until they are under control. I've had to do that with patients myself when it's clearly safer to wait. And that's hugely disappointing, but it's something which you should be taking control of rather than expecting your health to just get sorted out by the system. So how do you manage this situation yourself? You keep your exercise going as much as your hip allows. Low impact activities are best. Brisk walking, stationary cycling or swimming. Take painkillers to get you through it if you need to. Just stopping is not advisable. So NICE recommends 150 minutes a week of moderate activity minimum. That's exercising at a level where you get a bit short of breath during the majority of the exercise. You should be finding chatting to be slightly difficult, and then you have to stop talking every now and then to catch your breath. If you aren't getting short of breath, you simply aren't stressing your cardiovascular system. And that's just not enough to keep you fit. So practically, build up gradually, about 15 minutes to start off with, and use a simple heart rate monitor or a phone app to stay in your moderate zone, and exercise at a level where you feel short of breath. Once you're clear that your hip's going to need surgery anyway, there's absolutely no point in trying to protect it. So use it as much as you can tolerate and still keep fit. So next are some of the obvious really big ones. Stop smoking, cut right back on your alcohol, and avoid any recreational drugs. So smoking roughly doubles the risk of you getting an infection around your hip joint. There's meta-analysis studies which put the odds at 1.8 to 2 times higher for wound problems and deep infection of the hip. Stopping at least 6 weeks before your surgery makes a noticeable difference, and your GP can arrange to help you through the NHS stop smoking service if it's necessary. Excessive alcohol slows healing too, so really back off that in the lead up to surgery. So the next one's a bit harder, but if you know things are starting to come to a head as far as your hip is concerned, sort out your weight. And you know that's going to take months, not weeks. If your BMI is above 30, it increases your risk of a surgical site infection and later revision. And reviews show that the odds of that happening is around twice as high for joint replacements and hip replacement. Even modest weight loss helps, because this helps the way your body processes your glucose level, and that's a huge issue in your infection risk. In fact, it's such a big and important topic, in my opinion, that I'm going to dedicate an entire episode to it. So take a look at that one if it's a concern to you. Next is get your blood pressure under control. Raised blood pressure increases your risk of cardiac events and strokes around the time of surgery, up to 2 times higher. These are things that can actually kill you or cause severe permanent disability. If your blood pressure is not low enough, the pre-assessment nurse will flag it to my anaesthetist, and they'll delay your operation until it's under control anyway. So monitor at home, reduce your salt intake, stay active, and take any medication which is prescribed regularly. This is something which you may need to get help for. Your GP can review or adjust your medication and arrange an ECG if they think it's necessary. Control your diabetes properly. Your HbA1c, that's the long-term measure of your glucose control, with levels above 45, significantly raises your infection and revision risk, up to 3 times higher in some studies. So poor controls are a common cause of cancellation at pre-op. So monitor your sugars closely and follow your diet and medication advice. Your GP should check your glycosylated hemoglobin levels and help to tighten your control if it's needed. Thanks for watching, and try to stay active.